My name is Lindsay McLaren, and I'm pleased to co-chair this series with Trevor Hancock. I am joining today with humility and gratitude from the lands of the Treaty 7 signatories in southern Alberta, including the Piikani, the Kainai, the Siksika, the Stoney Nakoda, and the Tsuut'ina Nations. Today's session is focused on the Chief Public Health Officer of Canada's report on well-being and public health. I'm pleased to be moderating the session today, and we're very excited to have three excellent speakers whom I will now introduce. Firstly, Elise Thier is a policy analyst in the Office of the Chief Public Health Officer at the Public Health Agency of Canada. Bilingual in English and French and based in Ottawa, Elise has contributed to 9 CPHO annual and spotlight reports since 2018, supporting strategic policy analysis, knowledge translation, and health equity. Elise is committed to equity-driven, evidence-informed public health communication. Secondly, we have Sarah Maxwell, who is a senior science policy analyst in the Office of the Chief Public Health Officer at the Public Health Agency of Canada, where she provides strategic advice and advances development and knowledge translation of CPHO reports. In the past 8 years with PHABC, Sarah has held multiple advisory and management roles in biomanufacturing and vaccination policy, grants and contributions, and regional operations and border preparedness. Prior to joining PHABC, Sarah gained rural public health experience through roles in BC with First Nations Health Authority and Northern Health, and in local and provincial health and community policy roles in Newfoundland. Finally, Kelsey Lusick is a manager of intersectoral partnerships and initiatives at the Public Health Agency of Canada, where she oversees a team that is dedicated to working across sectors and advancing the conditions for success required for health in all policies governance. To date, her team has brought health perspectives into key whole-of-government initiatives, such as well-being policy, the Quality of Life Framework for Canada, and federal impact assessment. This team also supports knowledge exchange among practitioners in Canada, Canadian Network for Health in All Policies, and was responsible for launching PHABC's first community funding program dedicated to upstream intersectoral action on the social determinants of health in the form of the Intersectoral Action Fund. So thank you so much, Elise, Sarah, and Kelsey, for joining us today and sharing your time and expertise. And I will hand it over to you with thanks.
Thank you so much, Lindsay, for the introduction. Good morning, everyone. As Lindsay mentioned, my name is Elise Forte, and I'm a policy analyst with the OCPHO reports team at the Public Health Agency of Canada. I'm presenting to you today from Ottawa, Ontario, on the traditional and unceded territory of the Algonquin Anishinaabe Nation. I'm joined by my colleague, Sarah Maxwell, who is a senior policy analyst with the OCPHO reports team. She is joining us from North Vancouver, British Columbia, on the unceded ancestral lands of Tsleil-Waututh, Squamish, Musqueam Nations. We're the first of 2 presentations this morning, and at the end of our session, we'll be inviting you to share your thoughts through the Slido platform, just for a little bit of a short interactive discussion. We're really pleased to be with you today and to have the opportunity to share more about the 2025 CPHO annual report and how it can connect to your work. Next slide, please. So today we'll start with a brief overview of the 2025 Chief Public Health Officer annual report. I'll be saying CPHO for the rest of the presentation. We'll then explore how well-being and public health are naturally aligned and how much of the work that you're already doing can be understood as well-being work. A key message that we hope you take away is that this report is not just something separate. It's not something separate from your daily work, Rather, it reflects and reinforces many of the priorities and approaches already present across the public health system. We're also very eager to support your efforts to mobilize this report. One of our goals is to reinforce that we're available to follow up for questions, collaboration, and support, and to answer any questions that you might have. Throughout the presentation, we'll also share practical examples and ideas of how this can look like in the real world. Next slide, please. So more on the CPHO suite of annual reports. So under the Public Health Agency of Canada Act, the CPHO is required to submit an independent annual report to the Minister of Health each fall. This report is then tabled in both houses of Parliament. This legislative requirement ensures that the CPHO can speak independently on issues of public health importance and to provide evidence-informed advice to decision makers and to people living in Canada. The 2025 annual report was Dr. Theresa Tam's ninth and final report as CPHO. So this is really her capstone report. It reflects many of the priorities and themes that have shaped her tenure over the past 8 years. These include health system transformation, health equity, intersectoral action, the social and structural determinants of health, and Indigenous self-determination and reconciliation, and even the health impacts of climate change. So many of these themes are woven throughout the report and are particularly highlighted in the Way Forward section and in the Dr. Tam's opening message. So the way that her annual reports are generally structured is that they start with an opening message and they end with a Way Forward section. So if you're planning to mobilize or reference the report in your own work, we would be really happy to support you and are happy to collaborate. Next slide, please. So more on the 2025 annual report. So this report focuses on the growing momentum around well-being and how public health systems can both learn from and contribute to well-being initiatives. A central idea is that through a well-being approach, public health can help improve the conditions for both human and planetary health. Rather than focusing only on illness or risk, the report looks at more broadly at what can help people and communities thrive. Like previous reports, the intended audience is broad and kind of goes over the public health sector. So it looks at institutions, communities, and then also other sectors such as housing, education, environment, finance, and social services. This reflects the reality that well-being is influenced by many systems and actors, and that meaningful progress is requires collaboration across sectors. So while the report is grounded in public health, it's also designed to speak to a wide range of decision makers and practitioners. Next slide, please. So what is well-being? Well-being means different things to different people, and that's really something that we were very mindful of when we were developing this report. So in scoping the report, we first used the World Health Organization's definition, which describes well-being as a positive state experienced by individuals and societies. And we also looked at well-being as a multi-dimensional goal and approach. So well-being goes beyond individual health and is shaped by social, economic, environmental conditions. These areas are deeply interconnected. For example, access to safe and affordable housing, livable income, clean air and water, a strong community connection, and all of these things really contribute to people's ability to thrive. When we refer to well-being in the report, we also emphasize that it is both a goal and an approach. It's not only something that we measure at the end, but it's really something that guides how we design policies, programs, and systems. Indigenous worldviews, so those of First Nations, Inuit, and Métis people, offer deeply rooted relational and holistic understanding of well-being. These knowledge systems have been developed for over a millennia and emphasize collective intergenerational well-being, which is rooted in relationships with family, community, land, culture, and spirit. So we were really fortunate to work with Indigenous scholars and partners to integrate these perspectives throughout our report, rather than just treating them as an add-on at the end. Next slide, please. So well-being and public health, why now? Well, well-being has gained significant attention in recent years, particularly in the context of complex and overlapping global challenges. These include pandemics, climate change, economic uncertainty, social inequities, housing crises, and mental health pressures, among others. These challenges evolve over time and interact with one another, which mean that they cannot be addressed just by a single sector. COVID-19 clearly demonstrated this and also demonstrated the importance and benefits of working together across sectors and across levels of government. It also highlighted the existing inequities that we have in our society. Well-being truly offers a framework for responding to these challenges in a more integrated and sustained way. So it encourages stronger collaboration, shared goals, and longer-term thinking. It also provides a positive, strength-based lens for public health. So instead of focusing only on deficits, risks, and problems, it really shifts the attention towards assets, resilience, protective factors. Good health supports well-being, and the conditions that support well-being, such as stable housing, income security, and social inclusion, also promote health equity. So these things are all linked. We also cannot talk about well-being without considering the economy and sustainability. So there really has been a growing momentum, both in Canada and internationally, to measure progress beyond the traditional economic indicators like the GDP. So this shift really reflects the recognition that economic growth alone does not guarantee quality of life, equity, or environmental sustainability. A well-being approach or perspective embraces a broader and more meaningful view of progress, one that considers planetary health, future generations, and the fair distribution of resources. While well-being is not a new concept, recent crises and policy developments have accelerated interest in using it more as a unifying goal for public policy and for public health. So that being said, I will now turn things over to my colleague, Sarah, who will now walk us a little bit more through what these ideas mean in practice. Next slide, please.
Thank you, Elise. Next slide, please, Cheryl. Perfect. Thank you so much. So as Elise mentioned, we want to talk about some of the examples in the report, and they're in a few different domains. You see them here. The first I'll chat about is guidance. Well-being frameworks have gained a lot of global momentum. The WHO has adopted several, including the Agenda on Well-being, the 2021 Geneva Charter, but also recently, past July, the WHO released Implementing the Global Framework on Wellbeing at a Country Level, Policy Pathways. I know it's a long title. But this document provides practical guidance to ministries of health on how to translate the vision of well-being societies into concrete action through key policy pathways. And this is an example of a guidance document that Dr. Tam was able to contribute to in her time as CPHO before her tenure concluded. So we're extra excited about that one. Another domain of examples that we feature in the report are governance examples and how well-being can be advanced through governance measures. And I'll talk about well-being in a second, but another example we have is Wales' Wellbeing of Future Generations Act, which is how they've embedded well-being into legislation, policy plans, and budgets. The third domain I'll chat about is network. And so, two examples of that are the Canadian Network for Health and Health Policies, as well as the Canadian Wellbeing Knowledge Network. And we were able to engage with a few leaders from both of these networks in developing the report to gather their perspectives and make sure we had the language right. So, we're thankful for their time. The fourth category is local community initiatives, and this includes initiatives as well from First Nations, Inuit, and Métis communities. So some examples we have listed here are the Métis Vision for Health and the 8 Rocks model, which is a model that supports Inuit youth mental health. And then finally, we also have some well-being measurement examples in the report, such as the OECD Better Life Index, the Federal Quality of Life Framework, which I'll also come back to that one in a second, and the Canadian Index on Well-being. You see here as well that we have Engage Nova Scotia listed, and we were able to chat with them and highlight some of their work, especially in doing well-being surveys for Nova Scotia and really translating that information into through data visualizations with communities and doing community engagements to translate those findings into action. So lots of exciting work happening, not just all over Canada, but also beyond. Next slide, please. Thank you. So I mentioned I would talk more about some examples in detail. One is Wellbeing NL. Wellbeing NL is a multi-sectoral central organizing body supported by the Government of Newfoundland and Labrador that works to advance provincial well-being. The members of Wellbeing NL aim to collectively identify the potential for benefits across sectoral initiatives and highlight opportunities to align investments and leverage governance structures within departments to have more collaboration and get cross-sectoral input. And public health has been involved with the work of Wellbeing NL since its inception, and they've contributed to the steering committees and working groups, and they support communications and engagement out there. And the work of Wellbeing NL is also tied to health transformation initiatives, as well-being in general was a central theme identified during consultations on the Health Accord. And in 2023, health policymakers also integrated well-being as a central lens for public health when they revised the public health framework for the province. So there's lots of exciting work happening in Newfoundland when it comes to well-being. So just wanted to give an example outside of a BC context. Next slide, please. So the report also spotlights Canada's Quality of Life Framework, which was launched in 2021 to help the federal government measure different domains of well-being with the goal of supporting evidence-based decision-making. And it consists of 91 indicators covering multiple domains, as you can see in this graphic. We have the Quality of Life Framework, but Stats Canada also houses the Quality of Life Hub to analyze and house some of the data that comes across departments through a range of surveys on these areas. The CPHO report used a selection of indicator data from the Quality of Life Hub to provide insights into national trends in well-being dimensions. And you'll hear more about the framework in the following presentation from Kelsey, whose team really leads on well-being and health equity initiatives for PHAC. Next slide, please, Cheryl. Thank you. Public health, as Elise mentioned earlier, can learn from successful well-being initiatives and approaches. For example, well-being offers us ways of measuring shared outcomes and also how we can bring new partners together to generate innovative solutions. Conversely, public health can also contribute to well-being with data and health equity analysis and knowledge of social and structural determinants of health. And so this is kind of the base of the way forward for the CPHO report. Next slide, please. Thank you. So as in previous years, if you're familiar with CPHO reports, they conclude with a list of opportunities that we can act upon as a healthcare system to improve whatever the topic of the report is. And in this case, it's well-being. So this year, the report is divided into the two kind of sections that I just discussed. One being how well-being approaches can apply to public health, and then the other being the converse. So to begin, I'll just go over some of these, how we apply well-being frameworks to public health. So first, we can strengthen our competencies to actually apply these frameworks and collaborate further through intersectoral partnerships across sectors. And some example activities there are applying frameworks and collaborating. Next, public health can build on and extend existing work to measure positive health and well-being and promote those outcomes through strength-based framing. An example of this would be integrating health indicators with well-being data sets, and then supporting communities and actually using and designing programs based around these data sets. And then another domain where public health can really learn from well-being approaches is to inform sustainable policymaking for future generations by bolstering our long-term data collection and modeling efforts. This, of course, also includes continued support for Indigenous led well-being data programs. Next slide, please. Thank you. And so this is the other side of the coin, which is how we can focus on contributing to well-being through public health initiatives. So as we know, of course, public health can bring expertise in the social and structural determinants of health. And we can also help fill gaps on emerging areas. And an example of that would be in the digital determinants of health space. Second, public health can play a role in measuring and monitoring well-being inequities, and we can work to enhance existing well-being data sets by adding disaggregated health data. Third, public health can lead or support on intersectoral action, and that includes research, such as community-based research, to really capture local and traditional well-being knowledge. We can also join cross-sectoral governance tables or advocate for public health participation in new up-and-coming well-being initiatives. In doing this, we streamline efforts and we reduce duplication, and we also maximize resources for well-being initiatives. And then finally, public health has a responsibility to advance reconciliation and build renewed relationships based on recognition of rights, respect, and partnerships, which of course can also support well-being for Indigenous communities. And then last slide, please. Thank you. So we wanted to conclude today's presentation with a call for action, which is part of Dr. Tam's message in the report. We felt like Dr. Tam really had her finger on the pulse in selecting this topic. And as Elise mentioned, it builds off of the suite of some of her previous reports and touches on social structural determinants and intersectoral action and health equity and all of that good stuff. Before Dr. Tam's tenure ended, we were able to pre-mobilize the report through a few international and domestic venues. We did engagement with the Prime Minister's Youth Council for their perspectives on well-being. So we tried to really kick off some of the well-being momentum from our office before this report was even launched. Of course, we're still awaiting the news of a new PHO to be appointed. So once that individual is appointed, we will brief them on this report and explore what kind of opportunities would be appropriate to continue some momentum around well-being with federal CPHO leadership. But that is kind of it for our presentation today. I'm going to just share my screen now and bring us to a quick Slido before we transfer into Kelsey's presentation, if that's okay. So I will take over here. And it just needs a second, I believe. And I'll give everyone a moment to join the Slido. You can scan the QR code. I will just actually start it, but you can continue to scan. So our first question here today is, what competency can you utilize to promote collective well-being? This is just to get you reflecting on what kind of piece you do in your role and what skill set maybe you can bring. To give everyone a moment to join. And there's three kind of reflection questions before we go into Kelsey's piece, and hopefully we can keep the discussion going around these pieces as well once Kelsey's presentation is over. Okay, some answers coming in. I think you can answer as many times as you want for this too, so you can answer more than once. Obviously, seeing community engagement and intersectoral action come through, which is totally our domain. I still see some people typing, so I'll give this one another couple minutes before we move on. Seeing, ooh, empathy and reciprocity and reflexivity. I love that. Partnership.
Networking, understanding, collaboration.
Yeah, these are great. I also love seeing some of our technical domains too, like epidemiology. I think that's something we talked about
Mm.
a lot with this report is how to show folks, even in maybe a more technical field of public health who don't always feel like they belong in the well-being space, that they can contribute to or learn from well-being. So I love seeing that. And I'll just give one or two more seconds here on this one before we go to our next question, but this word cloud is shaping up super nicely.
Mhm.
Awesome. Thank you, everybody. I'll go to the next question, which is which aspects of the CPHO report do you find most relevant to you in your work? So, of those kind of opportunities for action that I just discussed, or the kind of different domains of examples, what relates most to you? What interests you the most? Um, and I'll give a few minutes on this one. Indicators, measurement. That's not surprising. And I think data leadership, holistic framework. Oh, this is good. I hope, Kelsey. I hope this gets you excited for your presentation because Kelsey is going to go right into this. Oh, the connection to planetary health is great. I know we thought a lot too um, about this report and tying it to some of the lessons from the 2022 and 2023 CPHO reports that Dr. Tam had, both on climate change and resilience. So that's great. Okay. I'll go another minute on this. I see some people are still typing. Anything interesting to you, Elise?
Yes, definitely focus on roles of community, collaborative engagement. These are all great.
Mm-hmm.
Focus
Overshoot.
on future generations.
Yeah. And if you're looking to learn from other folks outside of a VC space that are in that community partnership world, I really would encourage you, of course, to read the full report, but just to look at some of those examples that we've highlighted. There's some folks all over Canada doing amazing work in this space, and I think we can really learn from each other. And then our last question here in the poll is this is kind of a teaser for, I guess, Kelsey's presentation is, do you currently kind of incorporate the federal quality of life framework into your work? So yes, I'm familiar with it as an option and you're using it. Not yet. You're sometimes using maybe one of them, or you don't feel it's like relevant at all to what you do. This is just to help us understand, I guess, the level of familiarity before we get into Kelsey's presentation. Awesome. Lots of people eager to learn, Kelsey. And great to see that 25% or some people are already familiar with it and using it. So great. I think that's a great transition, hopefully, for you, Kelsey, if you're ready to um, take over.
Yes. Would you mind just confirming that my presentation is up before I let you go?
It's
Yes.
up.
Thanks, everybody. So hello, my name is Kelsey, and I'm really delighted to be joining you this afternoon from Ottawa, Canada, which is the traditional unceded territory of the Anishinaabe Algonquin Nation. And as I've been reflecting for my land acknowledgement today, I have been thinking about the immense privilege and opportunity that I've had to live, work, grow, age, and play in multiple provinces across Canada on multiple traditional territories that First Peoples have stewarded for generations before myself. And that includes my favorite place in the world, which is my hometown of Kitimat, BC, which is the unceded territory of the Haisla Nation. So I will be talking to you about well-being policy and health equity today, and the role that we've played at the Public Health Agency of Canada, which I will refer to as PHAC throughout this presentation, in bringing the quality of life framework to life with the spirit of well-being policy in mind. I'll talk about three different things. So first, let you know how the framework aligns with well-being approaches and advancing health equity. I will talk about how PHAC has experienced the framework as a well-being policy initiative and how we've tried to leverage that. And then I'd also like us to explore together the potential for well-being policy approaches really to foster intersectoral action to advance health equity. So this is a simplified diagram. I don't imagine that any of the content on this slide will be new or unfamiliar to this audience. But just as a refresher, as we know, the current context through which we're trying to advance health equity is quite complex. So we know that health inequalities persist, even as medical care spending continues to rise. We know that the pathways for acting on social and structural determinants of health are increasingly complex. Improvements to health often rely on actions from outside of the health sector, which is challenging and particularly challenging as all of our sectors are facing fiscal pressures. So, to advance health equity in this context, we need to work with non-health sectors and we need to find co-benefits to advance multiple priorities and work in ways that are efficient and leverage one another's actions. And ultimately, we would hope that draws on approaches including intersectoral action or collaboration and health and all policies, which have addressing health inequities as a core goal. So, as most of this table would be aware of, we also know that it is very hard to do intersectoral action and to implement health and all policies approaches. They are hard to get off the ground, particularly in the government context. And part of the reason here is because there is this predominant view of health as medical care. And we know that in the Canadian context, healthcare, medical care services, they already occupy a significant amount of space on the agenda. And so it may not always be intuitive for other sectors to see why health would need even more attention or to be at another table um, if it's not our primary sector, for example. Related to that, we also know that silos exist, and it can be challenging to navigate these silos within departmental mandates or within very clear priorities for a given sector. And this is where innovative government accountability and management structures could be used to incentivize shared ownership and collaborative action across different sectors. And then finally, there is a lack of evidence, and this gets back to the complexity of pathways for how our investments in other sectors contribute to health and other outcomes. And so, standardized evidence would be helpful to help us speak the language of non-health sectors and contribute to the work that they're doing from a data and evidence perspective. And so, given all of this context within health, as well-being policies started gaining traction over the past several years, which Sarah spoke to a bit about the momentum we've seen internationally and domestically as well, we have really seen it in our shop as an opportunity to advance intersectoral action and health and all policies with the goal of addressing social determinants of health. So, one of the reasons why we saw potential was because well-being policy gets away from health imperialism by being a very universally accepted goal. So, well-being is something that everybody can see themselves in or see the relevance of their work. And so, you build buy-in in that way, and you have different actors seeing that they can make a difference in this space in a way that's relevant to their mandate as well. One moment, I need a tissue. Sorry. Thank you. The other thing that we like about well-being policy is just the potential for it to be used to break down some of those silos. So not only do we share collective goals, but we can actually get together to talk about these things using the common language of well-being. And then finally, uh, health does not own well-being because it is a holistic framework. And so often well-being initiatives will be led outside of the health sector, which helps take the spotlight off of health and gets us a step away from health imperialism. And so with that, we've tried to leverage this window of opportunity. And so as Sarah mentioned, and some of you are familiar with this framework as you've indicated in the Slido, the federal government has developed a quality of life framework for Canada to measure what matters most to people living in Canada. And we often refer to this as the federal government's foray into well-being policy and well-being measurement. It is an indicator framework that measures well-being or quality of life holistically across 5 domains and 2 cross-cutting lenses: fairness and inclusion, and sustainability and resilience. It's an initiative that is led from outside of the health sector by central agencies. And this also brings an advantage of other government departments paying more attention to it because there are core things that we need to do as departments in directives from central agencies. And I'm not going to be giving a deep dive into the framework necessarily, but I will be sharing the value that we see from it of a health perspective and an intersectoral action perspective, and also how we've been involved in the framework's development and implementation at PHAC. I will note that the leads for the framework are Finance Canada, so they led on the development. And then when the framework moved into the implementation phase, leadership transferred to Treasury Board Secretariat. And then Statistics Canada has been responsible for maintaining the data and indicators and the quality of life data hub that Sarah alluded to throughout the process and to this day. And so that was the broad overview and infographic of the framework. And I'll flip back to it in a couple of slides to look further into the health equity links. But here I just wanted to provide an example and some information of what the framework looks like in its application in the federal space in our corporate processes. And this is one of the areas where we see strong alignment to health and all policies because the framework has been systematically integrated into several decision-making processes. So pictured on this slide is an example that speaks to the federal budget process, which Finance Canada provides the oversight for. So we're showing an excerpt from the 2025 template for budget proposals, which is publicly available. It may have actually changed as of today. But in short, every proposal that a department or agency puts forward in the annual budget process for government, which includes seeking policy authorities, they have to consider the impacts on quality of life based on the framework's domains and indicators. And so through those proposals, we show alignment with different sectors or different domains, and then that alignment is reported as a whole in the federal budget. So you can see how all of Canada's different investments have contributed to different quality of life domains. And so the image on the right of this slide is actually taken from the impacts report of the budget. So if you ever dig in to the annexes of the budget, there's really interesting information, which includes alignment on quality of life here. Aside from budget proposals, impacts for quality of life must also be documented in Federal Treasury Board submissions. So these are the approval documents for spending funds and outlining implementation details and expected results for initiatives. And then more recently, federal departments and agencies have been required to link their annual core responsibilities and priorities in their annual planning and reporting with the quality of life framework as well. So if you've looked at PHAC's departmental plan over the last couple of years, you would find under each core responsibility a narrative statement outlining how that responsibility or those activities contribute not only to the health domain, but also other domains. So just to give one example, the chronic disease and chronic disease prevention core responsibility not only contributes to the health domain by advancing self-rated health, self-rated mental health, health-adjusted life expectancy, children vulnerable in early development, physical activity. These are all indicators from the framework, but it also advances indicators related to good governance and society, so domains outside of the health sector. So it's one way we're able to show those links holistically. And that brings us back to the health role in all of this and why we're interested in the framework from a public health perspective. So first of all, the holistic nature of the framework is reflective of social determinants of health. So it, as I mentioned, it serves as this entry point for discussions across departments, particularly with the departments that hold those policy levers to act and influence social and structural determinants of health. Second, equity is also explicitly a piece of the framework. So it has the fairness and inclusion lens, which supports disaggregation of data and equity analysis of the indicators. And this is informed by the Government of Canada's gender-based analysis plus approach, which is a process for understanding how initiatives can be tailored to meet the diverse needs of the people that they impact. The framework also has the sustainability and resilience lens, and this helps to promote a long-term view of the indicators. So it can show trends over time for different indicators, as well as incorporate considerations for intergenerational equity, environmental sustainability, and community resilience. And then finally, I did hint at this, but the framework provides this common language or shared objective for us to collaborate around. So what we like about well-being is that it's neutral. It can avoid some of those pitfalls of health imperialism that we know so much about. And so illustrated here is, again, the framework, but also some select indicators where we wanted to show how social determinants of health are incorporated in these different domains. So the health domain is focused on a fairly traditional view of health with indicators for physical and mental health, as well as healthcare. But if you look across the domains, you can see many different determinants of health represented. So prosperity, we see measures related to housing, food security, as well as these traditional economic measures. In good governance, we see stigma and discrimination represented. In the society domain, there's elements of social cohesion, loneliness, and time use or work-life balance. And in the environment domain, it's more focused on ecological determinants of health, like air and water quality, built environment, green space, and impacts of climate change. So I've talked a bit about the government of Canada's approach and the alignment with health, but next I'm going to spend some time unpacking how PHAC has been involved in the development and implementation of the framework. So implementation of the framework writ large is really driven by the requirements of central agencies as the lead departments. So, as noted previously, Statistics Canada leads on the framework's indicators. And so they involve other departments with technical expertise or subject matter expertise. And PHAC has been a partner in this, engaged predominantly on the health domain, but others too, since 2019 when this initiative was first undertaken. So we've provided advice on public health indicators. And we've also made efforts to have the health domain move beyond just medical care and individual health behaviors represented. So this has resulted in the inclusion of an indicator on healthy eating environments, for example, which is forthcoming. As Statistics Canada just continues to finalize its new indicators as well as refine those that are already in place. So we expect we'll continue to be engaged from that perspective as the indicators move forward. And then we've also been involved in governance for the framework since it was developed. So this has included working level all the way up to our most senior level of management in our agency. It's given us the opportunity to keep senior decision makers engage, as well as connect with other departments to identify common areas of interest and highlight relevant FAC initiatives that could speak to the framework or um, show how we're using it in practice. And we did recently share last year's CPHO report on well-being by sharing some of those key findings with high-level representatives from across departments in the government. It was very well received as well. And then, as stated previously, the framework is implemented government-wide. Leadership comes from central agencies, and the three areas of work that I've just spoken about, indicator development, governance, and corporate processes, those are undertaken in many departments. So those are the things that we have to do. But FAC has also taken this unique approach to go above and beyond, given the interests that we see in the framework to advance health equity. So we've taken an active role in implementing and implementing in a way that goes beyond those core requirements of central agencies. So first, most departments participate in the framework through their corporate reporting and performance measurements teams. And so within FAC, our team in the Health Equity Division is the agency lead for the framework, which is a little bit different. But that allows us the opportunity to advance health and health policies and intersectoral actions. So we provide a center of expertise type role, but we also play a support function to FAC programs as they build in quality of life into their initiatives and their reporting requirements too. So helping move things outside of the health box a bit where we can make those thematic links with other areas of quality of life. We've also sought to build buy-in from across our agency on the framework. So we conducted a series of presentations or a roadshow with individual program areas to help socialize the framework and build understanding of it so that we could support implementation. And then finally, we've also developed a few tools and undertaken some analyses to support consistent application of the framework by the agency and look for opportunities to foster those intersectoral collaborations and health and all policies where we can, where we do see quality of life analysis featured in, say, the budget proposals. This has helped ensure that we're meeting the guidance set by central agencies, but it also helps us reflect on the role that we're playing and how our advice is being taken up and the impact that we're having as a whole in this space. We've particularly focused on advancing the framework and well-being policy more broadly as a way to advance health equity through intersectoral action and health and all policies. So we've worked to promote the framework as an opportunity for collaboration externally in a number of different venues. So several events and workshops for public health audiences on well-being, but also for government audiences too. So there have been times where we have presented alongside central agencies as a line department to show how we're mobilizing the framework and using it in our department and advancing health and health equity considerations too. So we have been pollinating those across sectoral understandings. And then in addition to our work on the framework itself, we do participate and support other domestic and international activities on well-being and quality of life. So you'll see some familiar terms here from Sarah's presentation as well. So we participate in the Canadian Wellbeing Knowledges Network, which is a non-government group led by Chris Barrington-Lee out of McGill University. This group brings together public, private, academic, community sectors to share ideas for advancing and supporting well-being policy approaches. And this is a network that was also launched fairly early in the framework's development in 2022. And among the various activities that it's been taking, it has created a scan of well-being policy initiatives in Canada, and it hosts dialogue sessions on the latest evidence, initiatives, and practices. So I would definitely encourage you to take a look at their website because they have a number of different briefing documents on several interesting areas of well-being policy as well as events that are always coming up. The WHO has brought forward two well-being policy initiatives in recent years that we've supported. So the first is in 2021, the Geneva Charter for Wellbeing and the supporting global framework for integrating public health into well-being. So both that charter and the framework identified 5 priority areas to foster well-being societies. So that included planetary health, equitable economies, healthy public policy, universal health coverage, and then managing digital transformation. So again, quite well aligned with last year's CPHO report on well-being. And then the second WHO initiative is the Economics of Health for All resolution from 2024. So this was a resolution that Canada co-sponsored to promote the significance of health for all as a public policy objective, and also positioning economies to deliver health and well-being outcomes. So the resolution called for viewing health initiatives and healthcare as long-term investments, not short-term costs. And WHO is now at the stage where they're preparing a strategy to operationalize this resolution and put it into practice across member states. And so participating in all these different activities does help inform our work, and we're able to learn from others' experiences. And importantly, we have also been documenting our own experiences in this space so that others can also benefit from our learnings as well. And so we have contributed to a compendium report that the WHO has led on health and all policies, or specifically multi-sectoral actions, but how they align to the new model for health and all policies. So I'm not sure if everyone is familiar with this model, but it outlines 4 pillars related to health and all policies, or HIAP initiatives, which include governance and accountabilities, leadership at all levels, ways of working, resources, financing, and capabilities. And don't worry if you can't read this slide because it is coming up in bigger font now. So this table shows our key findings that we found when we reflected on how FAC was involved in the development of the quality of life framework and what that means from a health and all policies perspective. So for governance and accountability, we found that some of the success factors for the initiatives were that the framework had and continues to have very clear interdepartmental governance structures across several levels of hierarchy within our bureaucracy. There was also a specific commitment to the framework in previous mandate letters for all of the government's ministers. So there was this commitment from the Prime Minister to all of their cabinet ministers to integrate and develop quality of life as part of their day-to-day work. And requirements to use the framework have also been systematically integrated into government processes, which we've talked about a bit in depth. For leadership at all levels, central agency leadership was really key to mobilizing and bringing together different departments around quality of life as the common theme. And there was also senior level buy-in linked to interdepartmental governance, and of course linked to the mandate letter commitments as well. The ways of working were also important for how the framework was developed. That included broad-based consultation from the leads, as well as having this dedicated team to lead the initiative and build a strong culture of collaboration within our government. And then finally, resources, financing, and capabilities. So as noted, there was this dedicated team, dedicated time staff set up to lead the initiative. They engaged expertise from across the government, and specific financial resources were committed to developing the indicators and ensuring we had statistical expertise in the process. And so if you'd like to read more about this, I would invite you to visit the WHO Compendium report. But I'll just summarize by saying that some of the challenges that we've faced in this space or that we continue to encounter, and I'm sure that you do as well, one is really the conflation of public health with healthcare or medical services. So we still do see this need to continue to socialize non-health sectors about the social and structural determinants of health and why and how public health can contribute to conversations that address our common well-being goals. Data disaggregation, as we all know, is integral to health equity work, and this is still a work in progress for quality of life indicators, but there is a commitment with resources behind it from Statistics Canada. Um, they have indicated that they need to look at well-being for all, not only averages. And in our current environment, with new federal priorities and capacity constraints, there is some uncertainty about future direction, but as of today, there's no shift with regards to the federal framework and but no specific messaging either way. So status quo, we're still using the framework. We're still very pleased to have it as a tool in our intersectoral toolkit. And then some of the key facilitators that we found, some of the lessons learned were really how important the culture of collaboration was that the leads set up to build buy-in across departments and just ensure that a range of voices were contributing. And so I think that's a lesson that applies to our intersectoral work, but also within our own house too, how to build success for initiatives maybe that are taking a whole of agency approach. The formal governance structure helped keep things running, helped keep momentum for a really challenging initiative task, and just ensured that decisions could be made by moving them through governance sequentially. The level of support from senior levels of government was certainly instrumental to ensuring the success and the momentum of the framework too, particularly as other priorities arose. So you've probably gathered, as I've referred to dates such as 2019 and 2022, that this did take place during the COVID pandemic. And so it was able to withstand all of these challenges and be implemented in quite challenging circumstances. And last but definitely not least, the authorizing environment was very important for the commitments that were set out in mandate letters to ministers and the requirement to build quality of life into government processes. These provided a roadmap and accountability measures to bring the framework implementation to life. And we can see that across a range of Government of Canada, FAC, any departmental documents today too. So ultimately, I'd say a learning here for us is that wellbeing policy needs to be nimble. We need to adapt to different contexts and we need to take the windows of opportunities as they open so we can contribute to the conversation. So as I wrap up, but just touching on a few areas where public health could explore how we leverage well-being, and I would offer these as a prompt for reflection and discussion of the group if you like. So first, we can mobilize public health communications to champion well-being messages and initiatives in support of the health-sustaining initiatives with intersectoral partners. So, for example, we can move public health communications beyond health topics when we work with other sectors. We can equip our practitioners with tools that enable them to speak the language of other partners. So how do we frame our interests to finance or environmental sectors? And how do we align our health arguments with the priorities of those sectors? So that's an exciting area of work. We also want to ensure that public health is engaged with the subjective nature of well-being. So our public health messages and actions framed in terms of what actually matters most to people versus assuming a definition of health that may or may not resonate for people. And this is where topics like affordability or housing or family can all come into play and contribute to. We can also seek out and further document how well-being approaches like quality of life have been used to further public health and in particular health equity goals. So we hear a gap often from senior management that they really need concrete examples to demonstrate the value of a well-being policy approach for public health. So this gets a bit to the evidence gap, but also the practice gap. Like how do we sell this within all of the constraints that we have so that we can collectively work together to move the needle on some of these very complex society goals while also staying within our public health lane? So, a complicated space. And lastly, an area that touches on the political realm. So, at the federal level, and I believe within the BC provincial government, I would look to others on the line to confirm. But I believe that there's been interest in mission driven government. So there may be an opportunity here to explore how well-being policy can help public health find those entry points into different missions where they're not on the surface health-centered necessarily. So this could involve things like mobilizing partners or facilitating discussions around those common well-being goals. We all have competencies as public health practitioners to bring people together in those ways. So can we contribute that to tackling some of these wicked challenges? We can also support knowledge sharing and collective discussion among intersectoral partners. This is why it's important to be involved in networks like this or some of the national level networks that we've spoke of too, because often we're trying to work in these complex spaces in isolation, and it helps to have others to bounce ideas off of or learn from or share experiences with as you undertake this work. And then finally, we can observe and learn from the ways of working of non-health sectors. So there could be certain areas where public health can benefit from the credibility of partners from other sectors, where we can learn to make our partnerships more meaningful or perhaps more results oriented or really overcome some of those challenges that we experience. And I'm going to pause here if everybody would like to take down the email so you can flood our generic inbox with any questions or interesting follow-ups. But Lindsay, that would be it for my presentation. There's a couple appended slides that I believe you'll see at some areas if you wanted to dig in more, but I will stop sharing my screen. Thank you for your attention, everyone.
Great. Well, thank you so much, Kelsey, Sarah, and Elise. That was a very informative and very engaging set of presentations. So thanks so much again for joining us and sharing your time and expertise. Um, we've got quite a bit of time for discussion and Q&A, which is fantastic. And so I will invite people to raise their hands, and then we'll allow you to unmute. I'm going to suggest, so having chaired a public health journal club here at the University of Calgary for several years, where the first hands to shoot up are always the physicians. I just want to make sure to carve out some space for non-physicians to ask some questions or have some comments. So while you're thinking about what would like to ask, um, I will take chair's prerogative and just raise a couple of questions. So I think I'll have maybe two. Um, so firstly, the first one is fairly specific, and I know there's interest in the room around kind of how this all works inside the federal government. So we're privileged to have you here, have this insider's view. So my question is around the Treasury Board and sort of what are they like, what are they doing in this space? So I'm familiar with the Statistics Canada Data Hub, but what is the Treasury Board doing? What is their role? Um, and then my second question, and I'll pose this really to all three of you. I've read the whole report. I read it with interest, and I appreciate sort of the interest in um, working within this moment where there's momentum around well-being. But that momentum, I believe, really stems or really has to do with the notion of a well-being economy. And so the beyond GDP part is very key. And in fact, it's not just that GDP is incomplete, it's that it's actually incompatible with like social and ecological determinants of health inequities. And in fact, I was just in a meeting this morning with the Global Wellbeing Economy Alliance, and the flavor of that community is quite distinctly degrowth in its orientation. So it's actually pushing quite strongly against GDP at all and the economic growth paradigm more generally. So I would just love to kind of hear how do you guys within FAC kind of engage with that, or do you? And like what would it take? And this is really a broader question for public health actors as a whole, but what would it take for our community as a whole to kind of engage in that space in a constructive way? So I'll just open it up for any kind of remarks along those lines. Thank you.
Kelsey, do you want to start with the Treasury Board roles and
Sure.
responsibilities? That's the
Yeah,
easiest
sure.
one.
Sure. So Treasury Board, currently they're the framework leads for implementation. And so that means that they play the secretariat function for governance committees. So I believe there is still governance at the working level, directors general level, assistant deputy minister level, and then they would be responsible for briefing any hire on the initiative. So governance is a piece of it. Um, they also manage the framework and not just the quality of life framework, but its harmonization with other frameworks in the government of Canada too. So we also have gender-based analysis plus sustainable development goals. So they make sure that these all align, they're not duplicating things, and that they're contributing in different ways across number of corporate processes that happen. And then also it's integrated into the performance and results cycle. And so our departmental planning and reporting that we've spoke to, like those feed into the whole of government approach and alignment for the government that Treasury Board would lead. Um, I'll touch briefly on your well-being economies question, but I'm mostly speaking as a interested person because there's no clear answer to this, right? I think that one thing that has been really exciting about the quality of life framework, which if you do read Finance's white paper, measuring what matters most to Canadians and how they developed it, it really does build from the beyond GDP movement. So that is a vision that is written about, but ultimately we can't act on what we don't measure. And so the fact that we now have a quality of life framework that's bringing together all of these indicators, I see that as a very positive step. And with the lenses that are also included for equity and sustainability and resilience, we can also see over time how these indicators has shifted. But the framework is neutral, and my role in this is also neutral as a public servant too. And so I think this is where we get at the practice and political separation a little bit too. So I would certainly have to flip the question back to you with respect to what does it take. But I will say that some of those examples that I spoke to in the presentation, like the WHO resolution that Canada co-sponsored for economies of health for all. We are still advancing that. And so it might take decades to really see if there's been a shift or not, but we're opening as many windows as we can along the way to keep public health involved. Sarah, did you want to add on that, or Elise?
We can build on it a bit with the role of the CPHO and their role in this. So, one thing that happened before the report came out, and that happened at a really timely point in report development, was that Dr. Tam attended the World Economy Forum, which is really central to that beyond GDP conversation. And she was a panelist at an event there, and actually spent a lot of time talking with some of the youth involved in the Beyond GDP conversation. and getting that future generations perspective. So we really tried to influence that, even if not adopting some of that traditional language in the report and capture that. Another kind of important role for the CPHO in general is to provide kind of measured but yet fiercely independent advice to the minister. And so when you have a CPHO that champions some of that thinking, then that can kind of go into those frequent briefings. I know there was a question in the chat about the cabinet committee on quality of life, and I'm not personally like the best person to speak to that, just because that's not our world. However, the Minister of Health is a member of that cabinet committee of quality of life, which is great. So our intentions in the Office of the Chief Public Health Officer are to support the CPHO and having those conversations about what strategic direction we need to go in as an agency with the minister and give that advice. So that includes some of that beyond GDP thinking, but sometimes it's not framed in that way. I know Dr. Tam was really keen on the balancing equity and sustainability thinking, but when you talk to her, when we talked about it's a lot of that same messaging as that beyond GDP thinking and that well-being thinking. And collaborating ties so closely with doing intersectoral action. It all ties together in this nice bow. So yeah, it's not a direct answer, I guess, to your question, but it's some of the ways that we've been framing things, at least in our office. Elise, you're nodding. I don't know if you want to add on to my answer or if you're
No, that was perfect. Thank you, Sarah.
Yeah, no, thank you. Thank you all very much. And I know it's a tough question, but part of the goal of this webinar series is to provide a forum to have these kinds of discussions. So thanks very much for engaging in that. So we'll go to Janice and then Barb. Janice, do you care to unmute?
Yeah. Hi. I have been involved in Health Canada's regulatory, basically following their policies and practices for over 25 years. And my group was particularly concerned, a team of colleagues that I've worked with, a very large team of colleagues from across Canada and outside of Canada, on December 20th, when the ministerial reliance order was published in the Canada Gazette. And I'm going to come back to that, because, and I recognize it deals with pharmaceuticals and emerging technologies, but I guess it's to sort of underscore that Theresa Tam's position has sat empty for the better part of a year now. She retired, I think, on May 1st or sometime around then, which isn't a good sign. And for FAC, in my mind, I mean, I was working at BGTD when FAC was created, and have sort of followed its lack of funding, its lack of, it's sort of interesting appointments for the chief public health officer. And I thought Theresa Tam has been really outstanding in her commitment to communities. But this matter of trust that you talk about in the alignment with health equity leaders, I think Theresa Tam gained that over the years, largely because she did really listen to all sorts of communities. I'm not sure that the current government, and I'll say this and throw this into the room, is garnering our trust in what they're doing with kind of the omnibus bill from 2024 and where they might be going with FAC even. Like, we're all kind of I'm wondering what's going on with FAC right now. What are they really going to do with it right now? And I wasn't really excited when the premier or the prime minister appointed Evan Solomon, for example, to lead the whole issues or all of the work around artificial intelligence and, our digital economies, our digital lack of transparencies. So I'm getting at transparency, I'm getting at accountability, I'm getting at real concerns. I think we saw it kind of showing up in the chat in Court of March. I don't know who that is, but I mean, his comments. I'm really concerned, and I'm not really. This was a fabulous, really fabulous presentation, but I'm more concerned now than I was even before.
Yeah, thanks for sharing, Janice. I'm not sure I can offer much, but first of all, thank you for the 20 years that you've put in working in this space and 25 years you've put in on regulations. That's amazing. So thank you for doing that. Um, I probably can't offer any solace for what you're expressing, particularly as an agency, like we are fighting to maintain the trust that's been built. We know mis and disinformation is the problem in public health initiatives and trying to tackle trust on so many different fronts. I think for public health, like what we can expect is a period of transformation and transition, right? So you'll probably see in our departmental plan coming forward that we'll be zeroing in on our core mandate or our core priorities, which may look different than in past years ultimately. And we do all miss Dr. Tam, but I'll say too, we have had maybe less public facing interim CPHOs within our agency that have been inspiring leadership for us. We've been facing a pretty difficult fall as a public health workforce here as well, and it's helped us get through and kind of keep our eye looking forward because we know that public health has these peaks and valleys, and we have to keep our heart a part of this work to do equity. So I'm sorry to hear what you're experiencing, but you wouldn't be the first person to raise it, and I think it's just a challenge we'll have to all face together. Sarah, Elise?
Yeah, I just want to echo. Yeah, thank you, Kelsey, and ditto to your comments. And I want to echo as well that we're not without a CPHO right now. We're just without a public facing CPHO. We do have our acting CPHO and Dr. Crowcroft. And as Kelsey mentions, there's been a lot of transition in the agency over the past year, especially with the workforce. Um, so yeah, maybe the attention of the agency has been a little more inward versus Dr. Tam, who was really able to blossom in her role as CPHO, being there for so long and establish that international presence. So we'll definitely look to see how we can continue momentum on some of these pieces when we do have a new CPHO in place. Also in our role as public servants with the agency and with the Office of the Chief Public Health Officer, we really like to reiterate messaging both to our senior leaders, but also to some of our colleagues and other program areas, the value of having language that reflects the importance of not just assuming we have trust from everybody, but also that it's important for us to earn trust and then when we do earn that trust, maintain it. And a lot of that work comes from investing in partnerships, especially at a community level, and calling things out when they're not quite right, and doing that kind of fearless advice and advocacy role. So we do have lots of really talented and dedicated public servants who continue to spread some of this good messaging. And yeah, that's kind of all I can add to that piece. Elise?
Thanks, Sarah. Nothing much to add. Just wanted to echo what you said, and that thank you for sharing your experience with us. And sorry that you're experiencing this.
Great. So I see Shannon's hand up, but I just want to check in with Barb, who has a question in the chat. Barb, are you in a position to vocalize it, or shall I read it for you? Okay, so Barb has asked, and Kelsey, I see you've responded, but maybe we'll just create a bit of space for this. So Barb asks, I'm interested in understanding how or if the development of this framework, and I think it's the quality of life framework, engage the public and First Nations to inform priorities, domains, indicators, etc. So any
Yeah,
of the three of you.
yeah, so my response for the quality of life framework, and again, like we didn't lead development, so this is really a question for finance, Department of Finance. But there was some Indigenous engagement in the development phase. It was also addressed that it would benefit from further engagement and further understanding for how quality of life framework aligns or not with Indigenous understandings of well-being. Dr. Tam's report took a much different approach. And so, Sarah, good segue to you, I think.
Yes, actually, I'll ask Elise to speak on some of the Indigenous engagement we did because she really led a lot of that. But if I could just for 1 second, I wanted to flag that again, we're not Stats Canada, so we're not the best position to speak to their work, but they did release a biennial review of all of their indicators within the last 6 months. And so I'm just going to post that link because it gives a good overview, I think, of some of the areas that Stats Canada and Treasury Board have recognized that maybe the data is not perfect or there needs to be more work done or there needs to be progress. So I'm just posting that in the chat because if you would like kind of a look behind the curtain at what's going to be in their work plan to make this a better and more equitable product, I think it might be a good resource for you. Elise?
Yes, thank you, Sarah. So part of our development process of the report is that we were engaging with NIOs, so First Nations, Inuit, and Métis groups throughout the process. So from the inception to the end of the report. So this meant engaging, on how we were selecting the topic, how we were going to narrow down our focus, and also talking about what kind of initiatives we were going to showcase in our report. And so this was really a collaborative process where we would engage with our different stakeholders and make sure that their voices were properly represented in our report. We also had the honor of working with an Indigenous artist, Lisa Boivin, who provided incredible artwork that you can see throughout the report. And it really showcases the different dimensions of well-being and kind of the history and the storytelling perspective of First Nations. So I encourage you, if you haven't had a chance yet, to take a look at that beautiful artwork, to take a look.
Sorry, Elise, I'm just going to add one more thing. I want to clarify one of my comments to the previous question as well, that Dr. Crowcroft, our current acting CPHO, is absolutely external facing. I don't want to make it seem like she's only working internally. She does represent the agency to events in a fantastic way, but maybe just doesn't have the same platform right now that Dr. Tam has in her acting role. So I just want to make that clear.
Great. Thank you. Thanks, Sarah. Thanks, everyone. Shannon.
Yeah, I just was reflecting on Janice's comments and on the incredible work that the agency has been doing in partnership. I love that there's a whole of government response here, but I do think it amplifies the importance of the advocacy voice in our work in public health and strengthening public health associations. And I also want to just say a huge thank you to the Public Health Agency of Canada for providing funding to help support this Wellbeing webinar series, which is allowing us to really explore the question of a wellbeing society in a fulsome way over the course of we'll be developing more webinars moving forward. Want to make an ad for our webinar on March 2nd, which will be focused explicitly on Indigenous perspectives on well-being. And we have a very, I think, senior leadership panel who will be addressing this discourse in a really meaningful way. And I also want to acknowledge that our work is only going to be more critically important. I'm noting Trevor's comments. Thank you, Trevor, in the chat around the role of cabinet and our voice and the potential of a social movement related to well-being society that can serve as that, as Labonte would say, the nutcracker, where we can continue to amplify. There are many, many powerful positive steps in the frameworks that we're seeing articulated as opportunities for whole of government approaches, and the work on indicators continues and is really where I started my career. So I'm seeing progress in some ways, and I know we're going into our AGM in the next couple of minutes. So I did want to say a huge thank you to everyone, and to you, Lindsay, in particular, particular, for leading us through this discourse. You have a minute or so to wrap up, and then we'll ask the folks who are not PHABC members probably to sign off, and we'll go forward into our steady reports. But so great to see you all. Thank you so much for joining.
Great. Thank you. I just wanted to maybe use our last minute if someone at the PHABC end could put the link in the chat for the upcoming episodes of the webinar series. I can't find it really quickly, but that would be a great way to end. And I'll just once again thank our speakers very, very much for sharing your time and expertise with us.
Thanks so much for having us, and happy to take any follow-ups after the call too. So thanks, everybody.
Yeah, it's really
Yeah.
great, really
Thank you.
comprehensive. Thank you so much.